And as soon as we get an opportunity, I'll introduce you guys to John Miller because he is eager to learn the liaison role. So
just reminded me to record, so.
Yeah, thanks, Carrie. Yeah, John's gonna listen to this later, you guys. So we
Super.
can't talk smack about him or anything like that. We have to be good. All right, I'll tag Elizabeth. She's a colleague at 9 Health, so Elizabeth Munoz.
Hi, everyone. Good evening. My name is Elizabeth Munoz, and I am CDC manager over at 9 Health. I have actually not been around too long. I have only been joined the group since July of last year, and I am happy to be here. My role with 9 Health is to go around and talk to people, different organizations such as Maria Gonzalez, who is here today, go around with different organizations and community members to try to bring vaccine clinics to the neighborhoods. So that's my role, and I love doing what I'm doing and love that I joined this group. And so that's it. Thank you.
Great.
We have Maria go next since you mentioned Maria. So are you okay with that, Maria?
Sure. Thank you, everybody, for the invitation. I'm so happy to be here. I will not be joining on camera. I am actually in home with some pain. I have a rotator cuff.
Oh.
So my shoulder has been with a lot of pain all day today, but I'm happy to be here on the call. I am with Adelante Community Development. We are an organization that serves the Latino community in the Adams County Front Range community. And right now, the most important thing for us is to continue this partnership to provide the vaccine and the access to testing and additional health preventive resources for our Latino community that we served. And so I'm, just here wanting to learn more about what everybody's doing and how do we really partner to make sure that we achieve the most, all of us together. So thank you again. And I'm looking forward to this 2022 with you guys.
Great.
Well, how about if I jump in next? Good to hear from you, Maria. My name is Alan Funk. I'm a retired telecommunications project manager for the airlines. I've been with 9 Health Fair more or less 10, 12 years. The first 6 years as on-site volunteer, and then the last 5 years or so as a site district manager for Adams County. And with the attrition of several of my fairs and the addition of the new ones, I'm really looking forward to having a brand new season after this last layoff. It's been way too long. It's great to be back.
Great. Becca, do you want to go?
Yeah, I can go. Hi, I'm Becca. I'm one of the site coordinators for the Boulder YMCA Health Fair. I started doing the health fair when I was in my freshman year of college, and now I am a senior. So I'm super excited to be doing my last fair and then passing it on to Max and Trinity for next year. So maybe they can introduce themselves next.
I am Max, as Becca said. I am a junior in college. So I was technically on the committee 2 years ago, but the fair didn't get to happen because of COVID. So I'm excited to actually see a 9 Health Fair happen, and I'm excited just to be along with the process.
Hi, I'm Trinity. I am a sophomore at CU, also working with Becca and Max, and this is my first 9 Health Fair, so I'm very excited to be a part of this process and learn and see how everything's done.
Super. Sarah.
Hi, everyone. My name is Sarah Lindahl. I am Assistant Director of Student Life at the Front Range Community College Larimer campus. And I am totally new to the health fair stuff. I am actually working with a lot of faculty members who will be having students earn some of their hours that they're required to. So just learning as I go and kind of picking things up, and I'm excited to be here.
Great. And Jenny is our medical coordinator, and she'll also be the lab supervisor at several of our sites. So Jenny, do you want to rave about yourself?
Yeah, I think you just did. Hi, I'm Jenny. Been around, this is 10 years, right, Carrie? 12, I think, 8 maybe. Anyway, lab supervisor, the medical coordinator is new, which I'm super excited about. This is great. I look forward to working with some new people. This will be fun. It's good to be back.
Yes, the health fair is addictive. Just warning you newbies that this
very much so.
Yes, this will become a new addiction. Okay, so I do have an agenda. I know I promised that we were only going to meet for an hour, so I kind of want to jump in this. Can everybody see the agenda? I want to make sure I shared the right screen. Okay, perfect. So as you can see, we have, these are the 5 fairs that we're including in our little family. So all 3 of the Front Range campuses, the Longmont campus, and you can see the dates are here, dates and times. Just want to make sure that I do have those correct. We do fall outside of the 9 days on a couple of these fairs, and that's quite all right. So we actually start out with the YMCA in Boulder. They're running early on the 16th of April from 8 to noon. And then it is the Longmont Front Range from 7 to noon on the 23rd. And Fort Collins is also running on the same day, which we'll make sure that you are prepared, even if it means that I come up there and make sure that everything is set up. Jenny and I can tag team that. We'll set up our fair and then maybe come up and help you set up your fair. Whatever works out, we'll make sure that you're ready to go. You have a lot of really amazing medical people. I mean, Angie Peach she's familiar with the health fair, so we'll be just fine. And then we have the Westminster campuses on a Friday from 8 to noon. And Spring is new. I thought she was coming today, but I don't see her logged in. And then the Mile High Flea Market is in mid-May. So it's a little bit outside of the 9 days, but it'll be a great site. I've never actually been to the flea market, so I'm kind of excited about that one. Any questions about that? Do I have all of those dates and times correctly listed? Perfect. And the Front Range sites, I do have a little update for us in particular. The college has rules about how many people can be on campus and serving food. And so I did get an update today from my dean. So, and that's coming from Andy Dorsey. So I'll end with that. Just some of the information that was shared at the last Metro Council meeting. So this agenda is actually almost a copy, but it's really great because it helps me remember, oh yeah, I need to tell you that. So just some of the volunteer engagement things that we can start doing, or dates that you need to be aware of. But all volunteers do get a discount of 20% on blood work and the colorectal kits. The code for registering online and entering that discount is Thank You Vol 22. It's the same every year. The only thing that changes is the date. T-shirts can be ordered for volunteers. The link, Alex, the link is not active yet. Is that right?
You know, I didn't actually check it the last time Kristen sent out nuts and bolts. As you keep going along, I will hop in the last nuts and bolts and see if it's working.
Okay.
And then I'll update you.
Super. The other thing that is really amazing, and especially for folks that are new, to become familiar with the resource guides. This is updated and complete in the system. And I'm just going to stop sharing the agenda and pull up the 9 Health Fair website, and we can take a look at where you find your resource guide.
And I'll just add really quickly while Carrie's doing that, for new sites, I will bring you a binder. So you'll actually have a physical copy. We do that with all the new sites, but then what Carrie's showing you is returning sites. We ask for just paper purposes. If someone really needs a hard copy, we're going to provide it to you. But if we can try to use the online versions and you're okay with that, that's definitely, they're thick. They're really big. So it's a lot of paper.
Yes.
But Maria and Sarah and Spring as well, I can provide you copies. We give 2 resource guides to each of our new site leadership teams.
So I am logged in already. So this is all of my information here. Just along the side, the dashboard, volunteer positions, blah, 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 medical. Down here, it says 9 Health Fair Resource Library. And it just has everything in there. And exactly what Alex was talking about with the nuts and bolts newsletter. So this comes out once a month and it's really great information. And that's where we can find some of these links for t-shirt orders. And some of the things that we go over in Metro Council meetings are found in the nuts and bolts. But best practices, documentation, and resource guide sections. Again, there's a lot of links here. There's a lot of data. So just a really amazing resource for kind of getting started and becoming familiar with some of the documentations. And maybe if you're not sure, what is the new centrifuge or phlebotomy policy? All of this stuff can be found here.
And I might make a recommendation for new sites, like what Carrie said, there's a lot in here. So it's a little bit daunting, a little overwhelming to look at. When you go to the resource guide sections, just start with that planning section. Section 1, it's going to give you a timeline of what you should be working on. So if you look at anything, start with that. Resource guide sections, planning.
Section 1. There's also some really great videos as well. Training videos. Really great stuff.
And I looked in the last nuts and bolts that went out February 10th, and t-shirts are at the bottom of that one. There is no link.
Okay.
She said, oh, Kristen said next month. She must have got informed it wasn't ready yet. I didn't even know that. I learned something tonight. So next month.
Perfect. Well, when it does come out, I'll be sure to email everybody the link so you can order it for your team.
Yeah, it's exciting this year. Normally it's just 10 for leadership volunteers. And we want you to order for all your volunteers. So if you have 75 volunteers that you want 9 Health 365 shirts for to wear at your fair, all in the same color so they look the same, go for it. Order for all of them. No restrictions this year.
That is awesome. Great. Also, blood chemistry vouchers. Each site will get 10. And if you feel like you need more, you can request more from Alex. Mm-hmm. We also get a site grant. So each site is awarded a specific value based on estimated participants. And those will be mailed out in March to the address that you entered when you entered your steps.
We're really going to focus on site coordinators. So what's in your profile for you specifically as the site coordinator is where we're going to send the check to. So I'll definitely be in touch with site coordinators to make sure that I have the right addresses for all of you where you want it to go.
And Alex, is there any idea how much the site grants might be? Is there
Yeah, so all our fall fairs got 250 because they were really just focused on the blood draw, and that was it. You know, they weren't doing a lot of other stuff, but we definitely see a lot of fairs that are trying to do more now. Our spring fairs are traditionally bigger. So it's, you know, Carrie is exactly right. We do base it on the number of participants and volunteers you think you're going to have, because then you have more people to feed, right? And you're doing a little more advertising. You might need help with the printing costs, that kind of thing. So typically most of them will be anywhere between, you know, 350 and 450-ish. If there's big concerns for you guys, some kind of one-off situations that we deal with outside of the site grants, or if you have security that you hire on site in your building, we have some locations that deal with that and they can't cover all the costs. Custodial fees, some of the buildings need to be cleaned top to bottom after the event. It's not a guarantee that we can always cover the cost of everything, but please come to me with these questions, because even if we can meet in the middle and try to help, you know, bridge that gap, we're going to do our best to make sure. But we try to handle those kind of situations with security and custodial costs or anything like that outside of the site grant. The site grant is really focused on, you know, the printing costs, spoiling your volunteers if you're getting food, you know, if you need extra sanitation kind of supplies for cleaning, that kind of stuff. That's the focus for the site grant. And we send a letter with the site grant check, so it kind of spells out exactly what we hope you're using that money for.
Great. I do know, Sarah, this kind of applies to Front Range. Like we're opening at 7, which means we need to get in the building at 6, and a security guard has to come an hour earlier just for us. And so that's an expense that might have to come out of our budget. Another fee is we have to pay our blood draws in the community room, and we have to pay for that room. There's something else we have to pay for. You might want to consider, Sarah, this is for Front Range, doing a, gosh, what is that form called? An event form.
The official function form.
Yes, thank you. Official function. And our dean is allowing us to use an official function form and pulling some money from the budget. So we'll be able to take care of some things like that.
We always try to beg a lot of our locations. We're a nonprofit. Can you give us a discount? So feel free to use that line. This is a community service. 9Health is a nonprofit. So
we do get a lot of donations, actually.
Awesome.
Banks and Starbucks gives us coffee and tea, and we have a bagel place that gives us food. So we'll have to talk about specifically, maybe we'll have a Front Range meeting sometime that's just for us, because we have some extra rules. Okay. So the volunteer management system, gosh, this is coming right up. February 21st is the go live. Is that the go live date, Alex? The 21st?
It is. There's actually already some health fairs in there that were super eager and switched their health fairs from pending to active. So there's some active ones already. And I am happy to support you guys with this. Okay. It's a new system. I would love to, you know, go to those videos that Carrie showed you. We're in the resource library and, you know, learn at some point, but I know it's a lot of pressure. We're all people that are doing things outside of giving our time for these events. So I'm happy to jump in there and support with you guys as much as possible. I recommend at least doing the basics in there, you know, so some organizations like Maria Adelante is a good example. You guys have amazing staff, amazing volunteers that come to everything that you guys do. But we might be able to back you up with the medical pieces because we have 9Health kind of loyalists that are used to our blood draw area. So we can set those up and maybe we leave more of the non-medical pieces out. So think about those kinds of things. Some things you might feel really confident that you've got it covered with your own resources. But other things you might really want to pull from the 9Health database of volunteers, and I can help you guys set those up if you need me to.
Yeah, I'm thinking like maybe interpreters
Okay.
that are bilingual in Spanish and maybe other languages, as we identified more opportunities. So definitely, you know, creating sort of a just a contact list of potential individuals that can help us, because
Yes.
translating average, it's, you know, not a problem. But when we're talking about medical stuff, I definitely want people to have a little bit more knowledge and to be able to translate the right manner, and you know, with the compassion in addition to the knowledge, because you know, sometimes if they have to ask some questions that are uncomfortable or giving some messages back and forth, you know, just making sure that we're culturally aware of every scenario and just providing those opportunities for the patients.
Mhm.
Yes.
And real quick, Alex, I know you have this great little big notebook that you carry all the time to the health fairs. Is there anything that has medical terminology that is in Spanish by any chance? Because even though, like, for example, I mean, I would definitely be volunteering with Maria, but even I would need a brush up on some of those medical terminologies. Do you guys have anything, or can I help you with some of that and maybe put something together to?
Yeah, our most kind of viable resource at this time, and you know, Elizabeth, and seeing what we're doing internally, that we're iterating, we're working, we have a, you know, a roadmap internally in the office to really get ready to serve more Latino populations in a culturally and linguistically appropriate manner. So we're getting there. It's going to be a slow process for us because we have a ton of materials. The one that is fully translated is that Ask a Medical Question binder. You probably saw Dr. Dill with that at the event last Saturday. So that one's fully in Spanish. So there's those resources. The lab supervisor training, because we're really, because of your space, Maria, going to focus on blood draw, right? And then maybe like we add on blood pressure or a couple other resources, but spacing wise, we would need one of your kind of bays for registration and one bay for the actual blood draw, because the space is just limited right now. And
Actually, you know, in regards to the space,
yeah,
we might, and I know you haven't been inside the flea market, but last year for the vaccinations, we actually had a 25,000 square feet and we had tents.
I got to see those.
So,
Yeah, I came once. And what was it?
Oh, okay.
August,
so
is that when we went, Elizabeth?
We might,
August.
you know, for May, we might be able to utilize that space. And so I'm just trying to figure out in the next couple of weeks to get together with the company that help us with all of the tents in all of those areas, because then we would have a much bigger area that we can really target and have different opportunities to add more services. Because I agree, the current space that we have right now is so small. But we could do some things that right there that requires like electricity and maybe more privacy, because we've got a contract there for the whole year, but then we can utilize the other space, you know, that is much bigger for maybe something more easier and does not require so much more of the privacy or, you know, just utilizing that.
Well, I'll just say for everybody, do me a favor, you guys, if you want more blood chemistry vouchers besides the 10, and those are worth $45 each to help at least 10 community members with it, you can request up to 15 more. Email me. Same with the volunteer management system. If there are volunteer positions that you know you want 9Health to support with, email me as well. Even if you're a brand new site, we still have, like, geographically, right? We still have volunteers in your area. So for like Sarah, we used to have Timberline Church run a big health fair up in Fort Collins, and we have those in our database. We can pull on them. Same with Maria. We had a lot more health fairs in Adams. And of course, you know, the Adams City High School, so we can pull lists of volunteers. We had a database of bilingual volunteers that were helping during the pandemic, and they were required to be bilingual in English and Spanish, and they were making phone calls for one of our partners, Stride, asked us to support with that. So we've got these little buckets of volunteers that we can pull from you guys. So email me which volunteer positions, medical or non-medical, that you want support with, so I can get it all set up. I'll get us going.
Great. Alex, have you been in touch with Karen Garcia?
She hasn't been super responsive. I did get a hold of the person at Rocky Vista, though. I don't know if you had questions about that one.
Yes.
I found the contact person. It took me a bit, but I got to her.
Because I still can't make a decision on PAP screening. I mean, we have the space, we have the tables. I would love to offer that, but I wasn't sure about this particular contact.
The woman is Adriana Hammack. It's Hammack. And so I know that's who Karen was in touch with to see if their students and faculty could come provide and do the PAP screenings. We are in touch with Quest. They're good to provide. We haven't for 2 years now, even though we've had some fall fairs. We haven't done any PAP screenings for 2 years. So for everyone that's new here, just so you know, this is the only screening that requires the lab piece of it. They have to, look at the specimens later. That is of zero cost. So it is 100% free to the women that need a PAP screening. Obviously, you need very specific space for this, the appropriate tables for it. So not every site can do it. It's tricky, but if you can't do it this year, it's something to look for in years to come because it's 100% free to the women that get these screenings. So we're very excited to do that. Adriana, Bobby from our team, Bobby Archer, and I have a meeting on Friday. I'm happy to invite you, Carrie, if you want to come, or I can just follow up with you if you're busy.
Yeah, that would be great.
Yeah, so let me know sooner than later on. Now that's the third one I'm asking you guys to email me about. If you do want PAPs and you think you've got private space and the right tables for it, I need to know pretty soon so I can just tell Quest that, hey, we've got another site. We also need a rough estimate, on the number of women you think that might utilize that screening, because we have to get the appropriate number of supplies. So it's so hard to know, right, if you've never offered it before, but just a rough number of how many you think will come so we can get the right supplies.
Great. Okay.
For PAP smears, is Quest the one that also interprets the results?
They send our health and wellness team the results, and then our health and wellness team, this Bobby Archer that I mentioned, does the interpretation and sends a letter out, because they're not really user friendly to the lay person. So we've always sent an additional letter with those results, and we mail them. If there's something extremely concerning, that RN is going to call the person before they receive their results, so they don't just get a result that's extremely scary before they're actually talk to a medical person. So yeah, we do the interpretation with our health.
Okay, awesome.
Perfect.
And Alex, I have a quick question. In the PAP smear as well as the breast exams, if we wanted them, they're all free, correct?
Those are totally free. Yep. It's just getting the right medical screening and having the right space that's always tricky, right? You can do it, but you of course need the appropriate people, and the spacing is, I know, Maria, you have grand visions of what's going to happen into the future in Mile High. So I think that would be amazing if we could support with that as months and years go on. I think a lot of people could use it.
Yeah, that is a big one.
Yep.
Great. The other component there is rheumatoid. So the RA group is still doing their study for rheumatoid arthritis, and traditionally they pick several sites and they come, and it's just an extra tube for blood draw. So if a person's already getting their blood drawn, they might opt into this study and get screening for rheumatoid arthritis. So if you're interested in this at your site, then you can just let me know and I can pass that along to Alex. And maybe if you feel more comfortable just emailing me, and I can kind of put all of our stuff together as one group and then send it to Alex, if that's a little bit more streamlined.
That's fine too.
That would
Yeah.
be great. It's really easy. It's an easy thing to offer, but if you're space limited, kind of like Front Range, we only allowed to have a certain number of people in the building. It might not work.
I do have to say the one nice thing about RA is it's a free blood draw, right? Somebody $0 and they're getting some blood work done to see if they have any markers for RA. So it's a cool one.
Yes.
Yeah.
Yeah, it's really an interesting study too. They've been doing for several years now. So it's a big study group.
Some of the time they even have, not always, but their group, some of the time they have this Dr. Kevin Dean. I think there might be another physician that comes and they also do a hand screening, but it's not 100% of the time that you're going to get the hand screening along with the blood screening. But that's an extra perk just to know and have the doctor actually like physically look at the hand and see if there's any concerns when they're physically examining someone's hands.
Nice. Let's see, other things, Quest. Okay, so when your supplies come, when you estimate, or when 9Health estimates how many participants you might potentially see, you'll be sent an appropriate number of, they're called A boxes. And these are your supplies for the blood draw area. So it's how many phlebotomist kits you will get. So those will be delivered by the National Guard to all sites just before your fair.
This might have been messed up in my notes, Carrie, so I really apologize. Your A boxes come from Quest, and so those are going to be via FedEx. All the boxes that come from 9Health, so anything for ask a medical question, blood pressure, anything that 9Health sends you is going to come from the National Guard. We'll deliver that. So I am so sorry if we messed up in Metro Council.
That's okay. Yeah, this is directly from that. So
we messed up then.
No worries. There are some trainings coming up, right? Lab supervisor training is really important. So if Jenny is not your lab supervisor, then whomever you have volunteer for this particular position needs to do a lab supervisor training. It is required. Being a lab supervisor is more than just kind of hanging out and watching people draw blood. It's actually not your job. There's a lot that goes into being a lab supervisor, and you're in charge of the centrifuge and the packaging of the blood and making sure that the paperwork is correct and things are labeled right, and you do the training at the beginning. So lab supervision, there's a lot of components there, and a few things have changed for the procedure and the protocol. So a lab supervisor training it's required, and I think Jenny, you're going to do another one. We do it almost every year. Actually, we do it every year because things do happen to change. So whomever your lab supervisor happens to be, they'll need to attend a required training. And Quest is also doing our phlebotomy refresher. So I know that's down in here somewhere. Here it is. So I'm hosting a phlebotomy refresher for any of your volunteers that might need to go over the process of drawing blood the day of the fair. Again, because things have changed a little bit. And we have, some people haven't done it for several years now, the 9Health way. It's nice to have a phlebotomy refresher that's, I'm hosting it, but the Quest trainers are actually doing the demonstration and the talk and going over the paperwork and the tubes and the kits and all of the rules that go along with it. So it'll be kind of very by the book and very succinct. So the phlebotomy refresher course that you can let all of your phlebotomy volunteers know once you get your list, once people start volunteering, you can let them know that there'll be a phlebotomy refresher right before the YMCA. So right before we kind of get this ball rolling, we'll have this refresher at the Longmont campus.
What time is that one going to be? We're going to set up
6 to 8.
6 to 8 p.m.
Mhm.
And then just an update, we did confirm with the Aurora Pima location if people need a second option, March 31st.
Great.
And that one will be, it's kind of a funky timing, but it's 5:45 to 7:45 p.m. And I'll make one note, if people ask you guys about these refresher courses, they are not for practicing drawing blood.
No.
They're for looking at the supplies and the process, like Carrie was saying. So a lot of people think they're gonna get to practice drawing, so.
I haven't drawn blood in 5 years. Let me go practice. That's not this event. Other upcoming trainings, there's some webinars for publicity. The next one is March 1st. And any trainings or recordings will be found in the nuts and bolts in your resource section. A cashier supervisor training is also available. I'd have to look in the nuts and bolts for that date.
Yeah, I think that Anne still was waiting for feedback from all the liaisons. So I'm not sure we had that totally set yet. But does anyone need help with cashier supervisor, by the way? Maybe you're not sure yet who your cashier supervisor is. Just thinking about it, service clubs usually really like this, Rotary and Lions. And yeah, Elizabeth, I know that you have personal contacts with some Lions clubs. So something to think about maybe for Maria, if she needs a cashier supervisor still, the Lions have historically loved to help us with that. So.
Yeah, they always talk about that. They're so great. Yeah, absolutely. I will definitely reach out to her.
Awesome.
Thank you.
Right, they're so personable and they're happy people. So it's good to have that that group working with the public. And if anybody wants to offer COVID vaccines at their site, it would be good also to let Alex know. And Alex, I did get approval for our campus to do the vaccines, so we would love to offer that.
Okay, great. You guys can either let me know now if you want it or email me, either way. Okay, and then Carrie, you guys probably see on this, Carrie and Alan will have those car boxes. That's extra supplies. So between, I said at the beginning, John Miller was also going to be learning and supporting as a liaison. So whether it's me, John Miller, Carrie, Alan, we all are going to have those car boxes with extra supplies. So if you see anything happening at your fair and you're short on something, that's what that is. We're there for you as your backup. For you, Sarah, I know that Carrie's going to be running a fair that day too. We do definitely prioritize having our staff at new fair sites. So you will 100% have one of our staff members there. So we got you covered. And then the last thing there, I don't know, Carrie, if you want to talk about the food and how that, or if you want me to talk about it.
So in the past, it's always prudent to feed your volunteers. So for our fair, we would actually have a hot breakfast and coffee from Starbucks and lots of snacks. And then we would offer them some buffet lunch we got food from Red Lobster and pizza from this place. And we just had a ton of food. But COVID changed everything. People cannot eat on our campuses, so we have to supply, if we're going to supply food, it has to be contained and they have to leave. There's no eating on campus, they have to leave. So we'll give them food, but they cannot eat on campus. So, or eat outside is another option. We thought about getting a food truck to come park in our parking lot, and then they can just, it's late April, right? So maybe they can just eat outside. But this is another thing that you might want to use some of your budget for, food. You also need to feed your participants. They need to have some kind of snack after the blood draw. A lot of them are fasting, and you want less people to faint, less people to pass out. So you need to offer them water, juice, and some kind of snack.
Granola bar or something.
Yeah.
And it's usually pretty basic. Like she said, you know, if you have little mini paper cups and you're putting juice in, or juice boxes, and some of the time places like, you know, King Soopers or Costco, they might want to donate, you know, and in those resource files, we also have a tax exemption form, so that, you know, if somebody is going, well, you know, what organization am I donating this to? You can use that. Maria, you're a nonprofit as well, so feel free to use Adelante's tax ID number. That's okay, because this is a partnership, so it doesn't matter which one you provide, whether it's the 9 Health Fair tax ID or yours. Yeah, so we know a lot of organizations, it's like place by place how they're handling food. Some places right now are relaxed and they're allowing it. Other places, like what Carrie mentioned, nope, you got to follow the guidelines. Here's what you can and can't do. So just know your site and what your regulations are there. So if we see a spike in COVID before the fairs that happen in April and May, then 9 Health itself would ask, and we have safety protocols from the fall season that we ran fairs. So we would put those safety protocols back in place and say, 100%, we are going to require that things are packaged, or you make a to-go bag, like Carrie had mentioned. But right now, as you can see there, I said, you know, you can serve meals as you did in the past. It's really site by site. It's different, right? Everywhere we go. So just know your site.
Exactly.
And then I think I missed that top bullet too. Christine Betts is on our philanthropy team, you guys, and she's working on asking our sponsors. So that's United Healthcare, Aetna, Well Advised. They're a Medicaid provider. And so they can come and educate people. If you guys are interested in having one of those at your fair, let me know. They love to join and see what's actually going on at the fairs. We have strict guidelines in place that they're not supposed to pressure people. They have protocol that they have to follow too if they come. So just rest assured that they have to be good.
Again, I think about this restriction of people that we can have in the building.
Yep.
Sarah, we did get an update on that. So it was 30 people in a space. And the dean told me that it's 100 now. So you can have up to 100, which is so much better. It's less restrictive. I thought, how are we gonna see 800 people in a 5-hour period when we can only have 30 people in a room? So that does open up an option to maybe have some of the sponsors come in and set up booths and give people a little something to look at and some access to that kind of information.
Yeah. Well, I mean, everybody has this agenda that Carrie sent out. So I think there's like 4 or 5 different places where, you know, it's follow up. Let me know what you guys need in the volunteer management system. If you need help with lab or cashier supervisor, I just want to caveat those offers for help. We always try. I can't always guarantee that we're going to get it. So if we're each doing outreach to try to find the resources that we need, we'll probably score, right?
Right.
So just have to put that in there. We're always trying, but it's never a guarantee.
Right. And I mean, there's 3 colleges in our little district here. So we all have phlebotomy students and medical assisting students. We also have graduates that are skilled in phlebotomy. So we have that opportunity, and we love to bring students. I mean, that's kind of our big thing for students. It's a big event for students. So even if they're not doing phlebotomy, they can do blood pressures and pulse ox and height, weight, and BMI. They can do some of your other screenings. They can do traffic control. They are at our mercy, right? They're at our beck and call. They can do whatever you need. And we are able to assist you in whatever position maybe you're lacking. We can stick a student in there.
That's great. And just so new folks know the requirements, and Carrie, you should probably say it, the requirements of how many students, if they actually are doing a medical screening, whether it's blood draw or another medical screening, that ratio, so people know.
So for phlebotomy, it is 5 students for 1 instructor. If they're doing some other assisting, they can do blood pressures and vital signs and those things. They don't need supervision. If they maybe are assisting with a PAP, or PAP would be what they would be assisting with. It's their one-on-one with the provider. But most of the time we're talking about students that come in to do phlebotomy. It's a 5-to-1 ratio. And like every phlebotomist, they only get 1 stick. If they miss, they have to pass that on to another person, a skilled person. And typically we say that the instructor can't draw blood, but there's been cases where I've had to be the second draw because everybody else is busy. So it's good to have a couple of instructors if you do have phlebotomy students.
Can I ask, for all the Front Range schools, do you have any phlebotomy students and or instructors that are bilingual in English and Spanish?
Students, definitely.
Okay. Because that's what we would want for Maria at her site, because it's a lot of Spanish speaking that are going to come through there.
I absolutely have students that are bilingual and know medical terminology.
Oh, great. Okay. Well, Maria, we'll have to talk about the screenings that you want, because we'll make sure to match up with what Carrie and all the Front Range sites can do to support you, and to have the appropriate languages also kind of paired up with what you're looking for. And then in addition to that, if we're not able to get everything that we need from the students from Front Range, we have some options with Regis pharmacy students. And one of my kids is yelling, so I apologize if you hear some background noise. And then Rocky Vista University also has students that what Carrie was talking about with PAPS, and they help with other screenings as well. So we will continue to communicate about these student groups.
I wanted to share with you that I had spoken with Liz about creating sort of a survey where we can start asking the community members, like, what do they think they would really like to have as far as the different services. And so I think, in the next few clinics that we are going to be at the flea market, we can start asking, like, out of priority, like 1 through 10, which ones are the most important, so that we are listening to them and don't assume that everything that we think it's really what they need. And so that'll give us a little bit of understanding so that we can plan better for that.
That's great.
Mm-hmm.
What other questions do you guys have?
I had a quick question in regards to just getting resources for the fair. So we're struggling in particular with getting tables and chairs donated simply because we normally ask churches and our fairs on Easter weekend. So that's kind of been ruled out. So I was just wondering if you all had any recommendations or like resources in that regard.
That is a tricky one.
That
I
is
mean,
tricky.
Yeah, we could ask kind of party rental places if they're willing to donate, since it's a community event. So we could try to call, those different party rental locations. Are there, what else is like, what other kind of businesses, schools, other than churches? Like what's nearby the YMCA where you guys are holding this?
So I reached out to the JCC because I know they have a fair,
Mhm.
Oh, yeah.
but I haven't gotten a response. So I don't know if there's probably a better contact that I could find through there. And then I've also tried like veteran organizations, kind of the same thing. So
Max, I'll ask my dean if we can borrow Front Range. It's tough because it's Front Range property
mhm.
and there's always a risk of damage. But I'll ask about tables and chairs. Can you give me an estimate of what you need?
Yeah. So we estimate that we would need about 50 tables and then 200 chairs.
Does the YMCA they have 0 that they'll let you guys use?
I haven't checked with them. I don't know if we've ever done that in the past, but
Yeah, they've never had enough for us in the past, unfortunately.
How did you get them from the churches you've borrowed from?
We rent a U-Haul like the night before, and then also Saturday, the day that we have the fair, to return all of them.
Okay, I'll ask tomorrow.
all right, thank you.
This is a new one. I haven't had to solve for that many tables and chairs. It's usually like we need 5 tables and 20 chairs. That's a lot. Let's try though, right?
Mhm.
So Carrie, you'll start, and then maybe next down the line is party rental companies. Maybe they'll be super uber generous.
So I have a quick question. So I work with different organizations throughout the community. I know that they certainly couldn't donate them, but I'm just wondering if I can get you in touch with the different organizations. Would we be able to return the tables and chairs? We would just borrow it for that day and then return it back by Monday?
Yeah, definitely.
Okay. Yeah, because I mean, I can certainly, I chair some of these committees, and so I can certainly do the ask. I just want to make sure, I'm sure they would want the tables and chairs back by Monday though, but yeah, absolutely. Or whenever, the next day or whenever we do the health fairs. But yeah, I'll definitely look for that. I'll write them an email.
Absolutely. Thank you so much.
Mhm.
Yeah, it's always our goal we like take down right after the fair. Like we have a whole club to take everything down and pack it all up. So yeah, we would definitely be able to return it like in a timely
Yes.
manner.
It is efficient at the YMCA, that's for sure.
Okay, yeah.
So,
Well, it sounds like we've got a huge team of problem solvers here. It's awesome.
Exactly.
Carrie, are you or Alan, maybe you, gonna send out kind of a debrief on this, on what we went over, or do you want my help with that?
I can just update the agenda about what we talked about, and I'll send out the notes and I guess this recording, if anybody feels like they need to a cure for insomnia, they could listen to this again.
Sounds good.
I've got just one thing real quick. Just a reminder that the steps in the database, steps 1, 2, 3, need to be completed, or we're requesting that it be completed by the end of this month. I haven't checked to see what the status is the last couple of days, but I noticed there's still one or two that need to be updated. So if we could get that done by the end of the month, that helps with everything as far as the planning goes.
Yeah, it's actually, well, one of the things that's going to stop us. So with the volunteer system going live on Monday, we need to know what screenings you guys want, because those screenings will tell us what volunteer positions to help set up. So the sooner the better. So the step one is really all about your location. If you haven't gotten in there yet, it's all about your site. The address, the date, the time for your fair. Step two is kind of your primary coordinator. So it's your, as a site coordinator, you guys are already attached to the fair before you see these steps, but then non-medical, medical, and your equipment coordinators, and where you want your supplies shipped to. So that's important for the National Guard, so we get your supplies to the right place. That's step two. Step three is your cashier and your lab supervisor. And then after that, after those three steps, then you have access to enter your screenings. You can't get to those screenings until those three steps are entered. So Alan, thank you for bringing that up. That is super, super important. And if somebody can't log in, if you're not able to get into, it's called our fair management system. Let me know. I can help get in there. Some of the time I'll just get on a call, a web call with somebody, and I'll do a screen share and I can literally finish it for you. You just tell me what to put. I'll type it in. Yeah, we've had a few people that have had issues getting in that system. That's why I make that offer, because I don't want that to be your barrier. So I'll do it for you if you can't log in.
Great. Okay. Anything else? Any other questions? You can also contact me if you feel like you need maybe some one-on-one little hand holding. I'm happy to do that. We can find a time to Zoom again, or we could meet face to face, either one.
You're our most experienced 9 Health Fair person on this call. She's definitely guru. Yes. Thank you, Carrie. Thank you, Alan, for helping lead the charge here.
Well, thank you, Alex, for coming
You're
tonight.
welcome.
Thank you for being our liaison.
You're welcome.
Thank you, everybody.
Thank you. Well, we'll have another meeting in a month. If this date, the Wednesdays are okay at this time. I know, Alex, you have something going on that next month.
Yeah, I'm okay to do night. I looked at it again, and the one that I have with Jeffco is at noon, so I'm good.
Okay, perfect. All right, well, I will update the agenda with some notes, and I'll send that to everybody if you need to review that again. And of course, reach out to me or Alex with any comments or questions, or if you have an answer to one of those things that we talked about tonight, you can also send that to me or Alex. Well, I'm so excited to work with everybody.
Have a good night, everybody. Stay warm.
Yes.
Thank you.
Be safe.
Good night.
Good night.
Thank you.
Good to
Night.
see you, and good
Bye,
to meet
guys.
all of
Thank
you.
you.
Too.
Bye-bye.
Bye-bye.
Bye.